How to create a natural feminine hairline. When patients come to see me regarding female hairline restoration or hairline lowering, they often focus on predominantly a single question: where should my new hairline position be? And while that might sound like a simple question, in reality it's far more complex. Because creating this natural feminine hairline is not about drawing a line across the forehead and doing a few simple measurements. You have to understand the facial proportions, the aesthetics, the hair characteristics, the long-term facial harmony that goes with aging. And rarely the best hairlines are the ones that people notice. They are the ones that simply look as though they have always been there. Today I'd like to take you behind the scenes and briefly explain how I can create a natural female hairline. First of all, it all starts with the face and not with the hair. One of the biggest misconceptions about hairline lowering surgery is that we have to be treating the hair. In reality, we're treating facial balance, and when assessing a patient, I spend a significant amount of time of the consultation studying the entire face. That would mean the forehead, the eyes, the eyebrows, the nose, the chin, the overall facial proportions, because a hairline that looks beautiful on one patient may look completely inappropriate on another one. So every face is unique. Every patient will require an individual design. That's why simply showing me a photo of a celebrity, I will tell you that it probably won't be suitable for you. Same goes for a lot of the social media influences. I believe that the goal should never be to try and copy someone else's hairline, design, or density. My goal should be to create the right hairline for that specific individual patient on the day. Lower is not always better, and that is valid most of the times. One of the most common requests I hear: can we make it lower? Can we go a few millimeters lower? And while a lower hairline can sometimes improve facial balance, it might not be the correct solution. Many patients arrive in consultations with photographs from social media, celebrity photographs, images that have been edited with a lot of filters. But we have to understand that hairline design is not about creating the lowest possible hairline. It needs to be about creating a hairline that looks believable. An overly low placed hairline will most certainly look artificial. It will create disproportion, and in some cases it will definitely not age well. A successful hairline, both for female and male patients, should look natural not only today, in a year, 2 years time, but also we have to plan ahead how that particular hairline will look 5, 10, 20 years. Softness will create femininity. One of the key differences between male and female hairline design is this softness, because female hairlines tend to have a gentle curve rather than this sharp angle going towards the temple. They appear often softer across the temples, definitely less aggressive and more delicate and rounded. Creating that softness will need meticulous planning, the objective being not to create a perfectly straight line, not even the micro zigzag performed in male hairline, because nature doesn't work that way. Natural hairlines need to contain subtle irregularities, tiny variations, small asymmetries, and the details might seem insignificant to begin with, but often these will be the ones that separate a natural result from one that can be easily spotted and artificial. These first few millimeters, I believe that they matter a great deal. Many patients think that density is the most important factor, but in reality, these first few millimeters, half a centimeter of the hairline, are often much more important than the overall graft count. The leading edge of a natural hairline should appear soft, feathered. This is where single follicular units will be definitely essential. These finer caliber hair grafts will create a natural transition between the forehead skin and the thicker hair behind. Without having this transition zone, even if the hair transplant is technically very successful, it will end up looking unnatural. The strongest hairlines are often the ones that are more suitable and more subtle. Another detail that patients forget to notice, but surgeons think about it constantly, is the hair direction. So natural hair does not grow straight upwards or straight forwards. And every area has its unique angle, orientation, when it comes to the central part of the hairline, when it comes to the corners, the temples. Each region will behave differently. So when the recipient sites are created, these differences in angles will matter. And it's a matter of degrees in how you orientate the incision, how you plan the graft. Every graft survival will be important, of course, but it can't compensate for a poor angulation. Naturalness will come from respecting how the patient's native hair naturally grows. Not every patient will require the same procedure. Some women, I found, they might be excellent candidates for the other surgical technique, which is surgical hairline lowering. Others might benefit just from hair transplantation alone, and there is a group of patients who will benefit from a combination of both. Hairline lowering surgery will basically advance the existing hair-bearing scalp forward, while hair transplantation will allow us to refine, shape, soften the edges, improve the overall density. The correct treatment, of course, will depend on various factors: scalp laxity, hair characteristics, facial proportions, and of course patient goals. This is why thorough consultation, proper planning are so important. One of the principles I discuss frequently with patients is, have you thought long term? Have you thought of the future? What is your long-term plan? A natural hairline should look good in photographs not just next year, but many years from now on. That quite often will require restraint. It will require careful design, respecting the natural anatomy, and the best outcomes, I believe, are often the ones that go fairly unnoticed. Friends, family, co-workers simply think that patient looks refreshed, looks more balanced, more confident, without clearly being able to identify exactly what has changed. And ultimately, this is what we aim for. Not perfection, not seeking attention, this overall naturalness. Because the most successful hairline is the one that looks like it has always been there, like it has always belonged to you.